Hi guys, it's me, Miss Wanda, Auntie Wanda. How are you guys doing? Hope you guys are well. Today is my day 5, battling and fighting COVID off. I do feel a lot better than what I was yesterday. I do, however, still feel the tinginess of fatigue here and there, especially now that it's getting later. I'm starting to feel tired, so you do feel that. The brain fog is there. I did have a virtual doctor's appointment that I made, when was it? Sometime last week when I found out that I was COVID positive. And of course, they didn't do anything. Basically, he just told me, of course, which I've already known, that they weren't going to be able to do anything. They're just geared towards treating the symptoms since my symptoms are primarily head. It's not in my lungs, basically. It's called an upper respiratory infection, which is, your nose and your throat. Lower respiratory infection would be your lungs. So thank God I have no pulmonary symptoms right now or things going into my lungs. But anyway, I just wanted to quickly come on here to show you some of the things that you can do if you are attacked with the BA2 variant. And I will throw out this disclaimer before I say anything. I'm not a doctor. I am a registered nurse. However, I am not allowed to give you medical advice. These are things that I'm doing for myself to help me get over COVID. Please seek the advice of your medical practitioner if you do have COVID or you get ill. And so, first thing, when I first got ill, of course, I told you guys before, I had a sore throat. It was very light and started off scratchy. And I did not gargle with warm salted water. That's an old school remedy. If that's what you want to do, you can do it. But there has been medical research that says that people who gargle 3 times a day for about 15 to 30 seconds each with certain mouthwash, and Listerine Cool Mint and Listerine Gold was one of the mouthwashes. They had a lower incidence and chance of having severe COVID. And I believe this study was done while they were hospitalized. So this is what I use. I take the capful and I gargle about 15. I count to 15. And if you're a little short of breath and you cannot, just gargle, hold, and try to take a deep breath in your nose if you can do it. If you can't, I don't want you guys to aspirate. And then, of course, spit it out. You don't have to rinse your mouth after that. This is really nasty. And it may burn your throat a little bit, but this is what I use. This is my go-to, my Listerine. I don't use a generic brand. I use the original Listerine Gold. And I use day and NyQuil. I like I don't like the liquid. If you like, you can take the liquid too. And I believe you take this once every 4 hours for, of course, if you have headache, fever, sore throat, minor aches and pains. This does have Tylenol in it. So if you take this, please do not take any extra pain medications. Okay, so this is what I used. I'm no longer currently using this right now. And Thursday, I had a vicious cough. Thursday and Friday, part of Saturday. And so I would use the Mucinex 12 hours DM. This is very expensive, but I liked it. It's a good expectorant. It thins your secretions and it makes it easier for you to cough it up. I don't know if I said this already, but this is kind of expensive. I think I spent, for 42 tablets, I spent close to $40 for this. They do have a generic brand, and I don't know, you know, the quality of it, but it's the same medication, but in generic form. Some throat lozenges, just to help you with your cough in between, and then also it helps to soothe your throat. One of the things that my doctor did recommend me do was to take vitamins, okay? So I take my multivitamin, which this bottle is almost empty and it's kind of stuck. I'll order some more. Any kind of multivitamin. As a matter of fact, I haven't had any today. So that's my multivitamin. Vitamin C, I take the liquid liposoluble vitamin C. And this is 3,000 milligrams of vitamin C. And they're liquid. It does come with a big bottle, but I found that it was going bad. So, and I was wasting it. It's kind of expensive. This is about $38 from Amazon. And I just shake it up, strip it, and just take it to the head. And because it's liposoluble, it's supposed to be more cellular, and it doesn't irritate your stomach as much. So that's the vitamin C. I have zinc, 50 milligrams, but like I said, when I first got sick, I was taking it. I no longer take it because I noticed when I take too much zinc, it causes my heart to palpitate. Yeah, I don't like that. Elderberry. I was taking some liquid elderberry, and I just ran out, so I'll be taking this. This is 400 milligrams of elderberry. Vitamin D3, which is 5,000 international IU. It's 1.25 micrograms. Remember, I was like, okay, is it milligrams or micrograms? But that's what it is. So I take 2 of these while I'm ill. Normally, I just take 1. A lot of patients develop blood clots during COVID. I don't have an issue with blood clots or anything like that, but I did buy me some 81 milligram baby aspirin. I haven't taken it yet, but I do take those too. Well, I don't have any water. Well, that's just great. And so I'm gonna have to hurry up and get out of here so I can run and get me some water. Hot teas, soups, no sugar, you know, try not to have very many carbs because the protein that binds to the cell wall receptor or to clog in is a glycoprotein. And for some reason in my head, I'm thinking, okay, so the more sugar you have in the body, the easier it is for the for the virus to bind to the cell wall. That's what I'm thinking. So maybe that's why diabetics have a hard time, and they get more severely ill because it makes it easier for the virus to attach to the cell wall. But anyway, it's something that I learned in anatomy and physiology. And so, and of course, nobody has done anything about it or done any research, but in my mind, that's what I'm thinking. So I'm very cognizant. I haven't even been craving any sweets. And lots of teas. I was drinking green tea, but I kind of stopped because of the caffeine in the green tea. They said the green tea is supposed to be good to help fight COVID, but I haven't been really drinking a whole lot of it lately within the past day or so. So these are lemon ginger. It's really good. This is my favorite, chamomile lavender, and this is by Organics. And so I've been drinking a lot of that. Matter of fact, I do have tea at it. So, okay, now I can swallow my vitamin D. And that's the lemon ginger. It's really yummy. Earlier, you know, you can either drink your teas plain, however you like it, with a little stevia or Splenda. This right here is just plain. Earlier today, I had some honey, a little bit of honey with this tea, the chamomile lavender. But I will just tell you guys, like I said before, honey does have sugar, so you want to eliminate as much as you can of the sugar. And lots of rest, no stress. Try not to stress about anything. Get down. Try not to stress about anything. It's so funny, my cat hasn't even been up here. And just relax, take it easy. If your body needs to sleep, let it sleep. Take as much time off as you need. I know that they're saying 5 days. You know, if you need longer, take longer. If you're a working person, you can always file for disability or something like that, okay? So, anyway, you guys be well. And I thank you guys for your prayers. I do feel so much better, but I am still on the mend, okay? God bless. Take care. Bye.